So, for example, with coronavirus data or COVID data, sometimes, of course, as we know, data is not always necessarily clean across the board. So, with health trends, do you all, in order to capture certain trends, for example, or certain outcomes, is there a way to sort of standardize it or kind of collect it in a clean way or aggregate it in a more clean way that's more easily, I guess, digestible?
Yeah, that's exactly what we do, is that we take the data as it is in its various formats, and you can imagine 50 states plus 50 plus formats. So it's kind of like, your original messy data problem. And that's exactly what we do, is we put it in a standardized format, in a standardized way to simply access it. On our initial forays into this, we started last March looking at data. And it was a bit frustrating watching some data come up and some data go down, and not having the same ways of reporting across states. That's still not solved. We can only take the data that the states provide. But it's important. So if in the beginning I'm in New York, which was where I happened to be, and New York was one of the first states, if not the first, to experience a really horrible set of circumstances regarding coronavirus. And yet the rest of the country was sitting there going, well, it's not really a big threat. We don't really understand why you're crying about this, because we don't see it here. And so if you were thinking that you would see it, you could take a New York curve of the data and use it to predict in your state. So as you started to see your infections increase, you might be able to predict some of the things that happen similar to New York if you were doing the same behavior. So you could take different states, different growth rates, and you could compare. And as simple as that sounds, like you should be able to do that, it's just really not that easy to do it with the way that the states have set up their data. No fault to the states. In general, public health is not very, very well funded. And so they do the best they can. And, after all, we were all swimming in an emergency. And I know that the states had data that was reported in many different formats, from electronic records to faxes. Sometimes it was phone called in. And I know that there was a very valiant set of public health experts within the states assembling that data, making it available to for publication every day so decisions could be made on it. But that being said, you can't expect that the states are going to have the money to come up with these easy, accessible ways. And they just, we're a limited budget. So there's really a very big need for a private independent group company to come in and help fix this.
So, in terms of access, would each, I guess, sort of local health department or federal agencies be able to access this information through health trends? I guess what's the way in which individuals would be able to access this data that once it's all sort of aggregated, so that
they could, yeah,
okay,
absolutely, they could. I mean, that would be something we would be very happy to do.
So how would it be integrated essentially into, is it say a platform that is, or a software package? How would that work? If I was a health department, I wanted to utilize health trends as part of
Right.
our efforts, how would that work essentially?
So in the first instance, we have a SQL database that we've set up, and it's pretty broad. It can encompass more than just health data. So there are other pieces of data you can enter in there if you want to compare and contrast. But in terms of what we're offering, it's either a report or an API, or, in certain instances, I'm sure that we could stream. But I find that a lot of times data isn't the only thing that people want. It's data with meaning. And so, yeah, you can stream the data. I don't necessarily know how much demand there is for that, because a lot of places want some interpretation to that data. And honestly, today, everybody probably rolls their eyes when they see the COVID statistics. You've been around this long enough. We're going to be around it for a while more. And people are just, you're kind of numb. And so I think that interpretation and meaning to data is really important at this point.